Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another commonly asked question. If you want to apply for a specialty that is different from your previous experience, so why are there specialties? So why do you want to choose why do you want to change to this specialty? So for example, if you previously work in the HEMONC department and you have a lot of that of experience, and now you want to apply for the cardiology, so probably the interviewer will ask you that why cardiology? Why do you want to change your specialty? So in order to answer this question, you have to think about is there any relations of your previous experience to the current specialty you are applying for, and is there any experience of do you have any experience of a current specialty, and you need to show your passion to apply for this specialty, and it's better to give the interviewer a good story or good example of your experience. And always add a reflection at the end of each story or experience that you have this reason to change your specialty. You have passion on it, so that's definitely what you want to do in the future. So you just re-emphasize those details and those points. So here I will give you an example of mine. So assuming that I was working in the HEMONC department for a longer time, and now I want to change to the to the cardiology. So here we go. So okay, Dr. Cui, so can you tell me that why do you want to change your previous training, trained subspecialty HEMONC to our cardiology? Can you tell me a little bit more why you do you want to do that? Yeah, that's a really good question. I would say that when I was a doctor in HEMONC, I saw a lot of patients there. We use chemotherapy for the patient, and after the therapy, some patient has had have a, a heart problem, cardiac issues. So because of those chemotherapies, so during that moment, during that time we really don't know how to treat the patient, and we consult the cardiology department, and because that's that actually they don't have any better way to treat this patient as well. So the only thing we can do is just reassure patient and use some and stop the chemotherapy or decrease the dosage, and balance the toxicity of the medication, and under the effect of under the effect of the medication. So, and also another way is to use some uh, uh, nutrition to support the cardiomyocyte function. Actually, it's it doesn't work very well. It didn't work very well either. So actually, from that moment, I was a little frustrated, and I really want to help those patients, but my specialty is HEMONC. So that's why I want to change to the cardiology to see if I can also help those patients. And specifically, the subspecialty I want to apply in the future is HEMONC cardiology in order to study the how can we save the patient who has undergone the chemotherapies with cardiomyocyte problems. So so that's my future goals. I so and also I really want to help those patients, and I want to see that if there's anything we can do for those patients in order to save their life, in order to extend their lifespan. So that's all I want to do. uh, I hope you will satisfied with my answer. So you can see that in this experience, I tried all my best to answer this question. And initially, I told them that my experience is monk, and after treating the patient with the chemotherapy, so the patient suffering from cardiac problems. So then I just mentioned that really want to help those patients. And in order to do that, I want to change my subspecialty to cardiology, specifically hem-onc cardiology. Based on my previous experience, and I should be good at this area as well. And by applying for this subspecialty, I can definitely do some research and on those patients and are all because I want to help those patients. I really have passion on it. So this is my answer for this question. I hope you get something to your answer as well. Also, I know some of you want to change your specialty or subspecialties uh, during applying during a match. So think about it and try to find your own, try to create your own answer. Good luck.